Hello, everybody. This is Gary. Today is November 27th, Sunday, 2022. It is 12:20 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today I'm doing okay. I went out for a walk and I did my physical therapy exercises for my right knee, which I had surgery on May 13th. There's still some pain and stiffness there, so it's important that I keep up my exercise, otherwise, the stiffness and the pain will actually only get worse, even though it does hurt to walk on it. Um, as far as my psychiatric symptoms today, they're not that bad. Depression is not that bad. Anxiety levels are not that bad. My paranoia and delusions are not that bad. My auditory hallucinations are at a bare minimum. Um, this Wednesday, I'm seeing my peer support specialist. That's a person who has a mental health diagnosis, in this case, obsessive compulsive personality disorder, and she works as a counselor on staff at my mental health clinic. And I will be seeing my psychotherapist the week after that, along with my psychiatrist that same week. I see my psychiatrist once every 6 weeks, and we haven't made any medication changes since a couple of months ago when we raised my Klonopin by half a milligram per day, which I think is helpful. It's keeping me out of the psychiatric emergency room. Um, the thing that might affect my mood coming up will be the weather. Today it's very cloudy out. It's raining a very little bit in Rochester, New York. It's cold, it's windy, and of course it's going to get even more cold, and eventually snowfall is going to come during November and December, I would imagine. I heard that Buffalo, New York got hit by snow. So far, Rochester has no snow on the ground at all. We had a few light flurries, but nothing stuck on the ground. Eventually, that'll change. And it always makes things more difficult. It can aggravate my hallucinations, my paranoia, my delusions, my depression, my anxiety. Um, but overall, my psychiatric symptoms are not that severe today, although I suspect as the weather gets worse, my symptoms might get somewhat worse. Um, but I'm doing okay pretty much today, just sticking to my daily schedule. I did some work on my computer. I do consumer surveys for extra money. Like I said, I did my physical therapy and walking exercises. I did some shopping for some things that I needed. I went to Dollar General. Um, the therapist appointment that I have coming up is week after next. I'm seeing my therapist every 2 weeks because this is a somewhat difficult time for me. It's always a little bit more difficult as November and December approaches, and I'm seeing my psychiatrist once every 6 weeks. He basically just takes care of my medication. I mean, it's not the same thing as psychotherapy. He's basically in charge of my medications. Not much else to do today. I'll probably do my laundry later, which is always a pain in the ass. I hate doing my laundry. Nobody likes doing their laundry. But I am lucky in regards that we have our own laundry room in the building that I live in, so I don't have to go out to the laundromat half a mile away on the bus. So I'm lucky in that regard. Um, but financially, I'm doing okay. I paid all my bills this month. I still have a little less than $300 in my checking account, um, which means that I'm pretty much balancing my budget. I'm not overspending. I buy what I need, food, clothes, that kind of thing, and still have money left over. Some over the counter medications that I'm on, I have to pay for myself. Um, particularly ibuprofen and Tylenol laxatives because my psychiatric meds can cause constipation. I have to pay for all those medications over the counter myself because my insurance doesn't cover them, but they are necessary. But financially, I'm doing okay. I can't complain too much. At least I'm not homeless in the middle of fucking November and winter. So I'm grateful for that. Um, but not much else to report on. I'm doing pretty much okay today. Uh, just feeling a little bored. That's about it. Did some meditation this morning. Did some meditation a little while ago. I usually do meditation when I take half a milligram of Klonopin, um, and that always helps me relax. I've been sleeping okay. Can't complain about that. I slept well last night. I was up at 5:30, but I also went to bed early, so I got up early. But I did get a good night's sleep. Ever since I started Cymbalta, which I take to control physical pain, I've also been sleeping better. Not just because my physical pain is reduced, because Cymbalta is an antidepressant, and I actually think it helps me sleep better as well as control physical pain. Um, my primary care doctor prescribes the Cymbalta and not my psychiatrist because I'm not taking it primarily as an antidepressant, although it may certainly help with my depression. But I'm certainly not going to be taking any opioids or other painkillers that are addictive. Um, so nothing else to report.